85%. Now, to help me go through them is Dr. Ruth Oratz. She's a breast oncologist and medical advisor to the Susan G. Komen for the Cure Foundation, the New York chapter. Dr. Oratz, thanks for joining us.
My pleasure.
Talk to me a little bit, if you can, about why it's so important for women to understand breast cancer, and most importantly, what do they really have to appreciate about this diagnosis?
The most important thing is for a woman to understand what her risk factors are for developing breast cancer.
All right. Most women think the biggest risk factor for breast cancer is family history. We heard a story of that nature. But the most important issue for everyone to understand is it's your exposure to estrogen that matters. Please explain that.
Well, you're absolutely right. Only about 5 or 10% of women with breast cancer have a genetic susceptibility or a strong family history. We now think that estrogen is one of the most powerful risk factors for breast cancer. So it's that exposure to estrogen by the breast tissue that can cause those cancers to start developing.
So I want to give you all a very short list. There are 5 questions that you need to ask yourself about estrogen exposure. Here they are. Did you start menstruating before age 12? Did you have your first child after age 30? Did you bottle feed your children? Did you go into menopause after age 55? And finally, did you have hormone treatments? Like example for getting pregnant or hormone replacement therapy at menopause. Those are the 5 questions. If you said yes to any or all those questions, it may mean that you've had high exposure to estrogen. So I'm going to go back and talk to Dorothy. And Dorothy, I know you've looked at these questions. You can one second. Actually, I need this. So I know that you've been exposed to some of these according to the questions that you've answered.
Yes, I have.
So I've got them in front of us. You remember which ones that you have exposure to?
The first one, did you start menstruating before 12?
Yeah.
And did you have your first child after 30? I had my second child after 30. And I bottle fed my son.
So 3 out of the 5 you check off.
Yes.
Because you've had increased exposure to estrogen. Right. Now, Dr. Oratz just finished teaching us a little bit about this. So you were diagnosed with breast cancer at age 50?
Yes.
Did you know that these risk factors had placed you at increased risk for breast cancer because it meant that you'd had more exposure to estrogen in your life?
No, absolutely not. I'm surprised to hear that.
How many of you are also surprised to hear that, as Dorothy is? Yeah, just about everybody. So I'm going to take 2 minutes here and explain to you why it is so vitally important to appreciate this risk factor that we can control. All right, I've got an animation here. And Dr. Oratz, you can't change that diagnosis, right, of whether or not you got pregnant early or bottle fed. But what factors can you control?
Well, the most important factor that we can control is our weight, is diet. Because we know that being overweight, having more fat cells, actually increases the amount of estrogen in our bodies. Fat cells produce estrogen, and they store estrogen. Women who continue to gain weight in adulthood, maybe more than 45 pounds, let's say, have a double risk of getting breast cancer.
Double the risk.
Double the risk.
All right. So we've talked now about estrogen exposure, and now we know that gaining weight is one of the ways we do that. I talk a lot about this on the show, about the importance of weight gain and what it can cause in your life, including an incidence of breast cancer. But let me show you why this is so important. If you look at an animation and you look at the fat we may have around our waist, no matter how much it is, hormones from there go up to your breast. Let's talk about the breast for a second. That's a cancer cell right there. And there's cells around it are normal cells. And that cancer cell will begin to squeeze them out of the way and push them. And now our immune system will send an immune cell to kill that cancer cell and cart it away. That's what's normally happening inside of our body. But if you have too much estrogen in your body, for example, because you've got some belly fat that you don't want to have, instead of this happening where an immune cell comes and cleans up your breast and leaves it the way it's supposed to be, this is what starts to happen. Let's move the animation forward. There's a blood vessel there. The blood vessel will start secreting estrogen and other chemicals. The cancer cells now won't stop at 1 or 2. The immune system can come in. That flourishing cancer cell will begin to grow. It'll bring new blood vessels into it. It'll start to get larger until it finally gets to a spot on your breast where it might become palpable, or if you get a mammogram, where you may be able to see it. That's one of the reasons that we focus on things you can't control. Dorothy, you can control some of the risk factors for estrogen. You can't control other ones. Dr. Oratz, talk to us a little bit about breast cancer and the density of the breast.
Well, dense breast tissue, we now think, is related to that estrogen story. The more estrogen that's around, the denser the breast tissue is. that may make it a little more difficult to see a cancer on the mammogram, but it also may mean that the breast tissue is more at risk for developing a cancer.
Yeah. Did you know that before?
No.
And this is one of the big misperceptions. Here are two breasts. Go ahead and examine those. You can use both your hands. And try to compare them and tell me which one you think is the denser breast. And just describe them to everybody if you don't mind.
I feel like sand in a bag that you're trying to push around. Yeah.
Is there a difference?
This one feels a little less dense, maybe.
You would think.
A little more squishy.
You would think. It was natural to think that by simply touching your breast, you could figure out if they're dense or not.
Right.
Right? That makes sense. Turns out, you can't. You can't. Dr. Oratz, how can women tell if they have dense breasts?
The only way to really know if you have dense breasts is with an X-ray, a mammogram.
And
You can see, here's an example. So the very dense tissue on the mammogram looks all white, and we can not really see through that. There might be a little cancer hiding in there. Whereas a breast that's not dense, we call that fatty, looks very clear, and it's much easier to detect an abnormality there.
So, Dr. Oratz, while we're on this topic, there's been a big debate about the age at which women should start getting their mammography. Many organizations say age 40. A lot of doctors think that age 50 might be the right age. Give us some advice on this. I mean, you're a world expert in this space.
Well, we do think that women should start having screening mammograms at age 40. That's very important. And maybe if you have some of these increased risk factors, maybe start a little bit earlier. As we're learning more and more about breast cancer, we may start seeing a shift in those recommendations, so women who have a lower risk may be able to start a little bit later or go a little bit less frequently. So we're trying to figure that all out.
You know, it's a law in some states now that you have to be told this. But for everybody out there, in most of the country that's not the case, please ask your doctors. Once you know that, it changes it. Let's talk a tiny bit about it. Thank you very much. So once you know you have dense breasts, what's the next thing you need to do? It's to find out about newer screening tests. And Joanne is joining us. How are you, Joanne?
Nice to meet you both.
Thanks for being with us. So come on over here. Let me talk to you about it. Do you know if your breasts are dense or not?
Unfortunately, they were, yes.
They are. So you've had mammography. They told you that. And how have they been screening your breasts because they're dense?
Well, let me step back a bit. I felt doing all the right things, eating right, exercising, never missing a doctor's appointment, felt a lump during a self-exam, and went for a mammogram and sonogram that day. On the mammogram that day, I went in, did the exam, the tech left the room, came back in and said, okay, you're all clear, you can get dressed. And I just assumed she'd come back into the wrong room. And I said, oh no, I'm the lady with the lump I can feel. And she said, oh no, you have dense breasts. It's unlikely, that would be a very difficult find for us, is what she told me. And I remember saying to her, wait, what? That was the first time I had heard the term breast density. And of course it was picked up, 10 minutes later I had the sonogram, it was picked up. So the first day I heard that term was the day I was diagnosed with breast cancer.
Oh my goodness. So Dr. Oratz, help us understand this better. What should women do if they do have dense breasts? Talk about some of the newer imaging techniques.
Well, we've heard about one of them, which is ultrasound or sonography, and that's very helpful if the breast tissue is dense, and MRI can also be helpful. But there's a new test that's just recently been approved by the FDA. It's called digital Tomo synthesis, and this actually takes a three-dimensional picture of the breast, and with these little slices, the computer then creates a three-dimensional image,
like
and we can
actually
really see tiny little abnormalities in the breast tissue. It's a very exciting new technology.
So again, this is an animation of that, but this gives us an ability to see things we couldn't see before. So for the many women who have dense breasts, at least it can move us along on the path to making the right diagnosis. Good luck to you.
Thank you so much.
Thank you. All right, let's move on from the most sophisticated tests to the most basic one. Welcome, how are you?
Hi.
And you've got to make sure that you know your risk of breast cancer. So in order to do that, you have to make sure that you don't ignore your self-exams.
Yes.
All right, what's your first name?
Kelly.
Hi, Kelly. Tell me your story.
Earlier this year, I was a young nursing mother, found a lump myself while reading to my daughter, had follow-up testing, mammograms, ultrasound. Turned out I had breast cancer, but it was very evident that it had spread to my lymph nodes, which were huge, actually bigger than the lump that I found. And that's something people
Just so I
should
can
be aware
understand this better,
Yeah.
you felt the lymph node mass at the same time you felt the breast cancer
No,
mass?
I felt the breast cancer mass, and then the doctor pointed out the lymph node mass, which I didn't even know to look for. I wish I had. I might have found it a little sooner before it had been, gotten to my lymph nodes.
Dr. Oratz, help us understand this a little bit better. The self-exam issue has been controversial as well. Women should do it, I gather.
They should absolutely do it, and especially young women, because they may not be going in for screening. So, and we've heard that from, I think Lisa told us, that self-examination is absolutely the way that I see women present with breast cancer all the time. Now, when you're doing that self-examination, as we're hearing, you need to not only examine the breast, but know that breast tissue goes, I'm going to show you, it goes all the way up, just to under the armpit. That's breast tissue still all the way up. And then these lymph nodes up here in the armpit can be draining a cancer from the breast. And sometimes the lymph nodes get swollen and form a mass even before you might notice a lump in the breast.
So listen, it's not just about examining your breasts. It's also about looking at your breasts. Look in the mirror. If you notice any changes in how the skin looks, any bumpiness, sometimes it'll look like a rash, change in texture, if the shape has been altered from what your normal is, because you know your breasts better than anybody does. If that's the case, then at least you can make the diagnosis. All right, so the good news is that breast cancer can be beaten, especially if you find it early. So log on to DrOz.com to get the Susan G. Komen for the Cure Breast Self-Awareness Card. It'll help you get what you need to know in order to figure out what's normal for you and what's not. I want to thank Dr. Oretz very, very much for your sage advice.
pleasure.
To all my guests, coming up next, the most important foods to fight breast cancer.